So once again, welcome to Drug Education by Southwestern FINMA students in the course of Doctor of Dental Medicine, or in short, dentistry. So before we begin, I would like to I would like you all to see the faces of our speakers. So nara sila, including me, myself. So narang mga gwapo-gwapo natin na speakers. So to, to move to move forward, we prepare a short video for a brief knowledge or understanding on what our webinar is all about.
Good afternoon, everyone. A question. Are you aware that there are legal and illegal drugs? Before we proceed to our main discussion, we are going to have a short energizer about our topic for today. We are going to identify the illegal and legal drugs by flashing some pictures. Just take note of your answer, and later on you will find out which ones are the legal and which one are the illegal. Okay, now let's proceed to the introduction.
Good afternoon, everyone. I am Edgardo D. Tutor II, and for today, I'm going to be the speaker for today's introduction. Drug addiction is a problem faced by many people in the world, most especially teenagers. Drugs are very harmful and keep the capability of drugging an individual towards death and destruction. Many young people become dependent on different types of substances like shabu or rugby or ecstasy and stimulating medicines that comes hand in hand with narcotic effect. Next slide, please. The alarming rate of drug consumption has always been a problem, especially here in the Philippines, and has determinal effects on the society. Like for example, katong na oplan tokhang nagi held ni President Digong, in which the result is that it has many casualties, especially sa katong naggamit og mga drugs. And the worst thing is that drugs affect the youth in every country of the world. Next slide.
So, I'm the speaker for legal and illegal drugs. I'm Leighton Dwayne Atizon. Before we start, what is drugs? Drugs are chemicals that affect the way the body functions. You already heard that drugs are bad for you, but what exactly does that mean and why are they so harmful? First we're gonna discuss about legal drugs. Medicines are often referred to as legal drugs. If you ever been sick and have to make medicine, you're familiar with one type of medication. Medicines are legal medicines, which mean that doctors can prescribe them to patients and pharmacies can sell them and individuals can purchase them. So a while ago when Speaker Missy was about to question you about identifying the which is legal or illegal drugs. If you identify correct that those illegal drugs that has prescription that has RX or those prescription medicines that prescription medicines about the doctors is known as legal drugs. Okay, when we talk about illegal drug, we're talking about a product that has an impact on how the body works. The term illegal refers to a drug that is prohibited by law. People's reactions to various illegal drugs vary, and these reactions are affected by a variety of factors. As a result, they are unpredictable and dangerous, particularly to children and teenagers. So we have some examples here to flash. So this is cannabis, or also known as marijuana. Cannabis has brain side effects, or also can affect lungs. For the brain side effects, it can cause you delusions, disorientations, disorganizations, hallucinations. For the lungs, if you are smoking marijuana, even infrequently, can cause burning and stinging of the mouth and throat, and can cause heavy coughing, daily cough and phlegm production, increased risk of lung infections, and more frequent acute chest illness. Pwede sa itong lung cancer. So for the next example is cocaine. Cocaine is a highly addictive stimulant drug used by 14 to 21 billion people worldwide. Unfortunately, many people suffer unpleasant consequences as a result of their cocaine use, such as HIV infection, hepatitis B and C infection, mood disorders, cardiovascular disease, respiratory illness, high blood pressure, stroke, seizures, weight loss, and many more. So for the other example is MDMA, or also known as ecstasy. For this, if you are a regular use, it can cause you to sleep disturbance, lack of appetite, concentration, depression, heart disease, and impulsively have an associated with regular use of MDA. And there also a risk on people who are used to this MDA. Various studies have found that MDMA is used to associate with risky sexual behavior. For example, both males and females who use MDMA are more are more likely than alcohol drinking controls to engage in risky sexual behaviors. So, dili lang male o female ang pwede mo-engage, pwede po ang same sex to mag-engage of sexual behaviors. The next example is gay HB, or also known as grievous bodily harm. So for this example, the side effects of this is it can include drowsiness, amnesia, and impaired movement and speech, as well as more serious symptoms of agitation, unconscious, and respiratory collapse. So let's gonna move to the next slide to see some examples. So here we have methamphetamine. Methamphetamine is also all known here as shabu in the Philippines. It increases the levels of naturally occurring dopamine and norepinephrine in the brain. The effect lasts longer than with cocaine, and it's cheaper and it's easy to make with commonly available ingredients, which is a potent drug, so it remains a serious drug of abuse. Methamphetamine use can lead to a number of other health problems, including dependence, heart problems, and other physical and mental health issues like Parkinson's disease, memory loss, violent behavior, mood disturbance, and severe dental problems. So another, we have ketamine. For this, it is a very powerful anesthetic that can cause serious harm. Taking ketamine can be fatal, particularly if it is mixed with other drugs. Ketamine can increase your heart rate and blood pressure. It can make you confused, agitated, delirious, and disconnected from reality. It can make you feel sick, and it can cause you damage to your short and long-term memory. So, heroin. So, as you can see, murag familiar ka siya ang heroin kay murag ginagamit ko siya sa mga movies or mga kuan bitaw sa mga salida. So, ang heroin is kanang mga people who use heroin typically report feeling a surge of pleasurable sensation, a rush. The intensity of the rush is a function of how much drug is taken and how rapidly the drug enters the brain and binds to the opioids receptors. With heroin, the rush is usually accompanied by a warm flushing of the skin, dry mouth, and a heavy feeling in the extremities, such as nausea, vomiting, and severe itching may also occur. Sa hallucination, murag mushroom, di ba? Murag dili siya drug, but it's also considered drug because it is a use of mind altering drug. So these hallucinogens is the effect of hallucinogens can last several hours and vary considerably depending on the specific type of hallucinogen. Some type of effects of hallucinogens are feeling of euphoria or also called pleasure, blurred vision, hallucinations, and distorted perception, disorganized thoughts, confusion, and difficulty concentrating or maintaining attention. And lastly, inhalants. So from the looks of it, di murag dili gyapon siya drugs, pero it is also considered drugs. Um, Inhalants are starve the body of oxygen and force the heart to beat irregularly and more rapidly. Users can increase nausea and nosebleeds and lose their sense of hearing or smell. Chronic can lead to muscle wasting and reduced muscle tone, and the poisonous chemical gradually damage the lungs and the immune system. So, ang mahatag siguro ako na example here in the Philippines is murag rugby because they inhale it. So, that's the end of my discussion. I'm gonna pass my voice to another speaker.
Okay, good afternoon, everyone. I am Nina Katia, your drug addiction speaker. Next slide, please. Okay, so what is drug addiction? Drug addiction is a common neurobiological disorder that has negative effects on the brain and the body. To resolve this, an integrated treatment plan is needed. So many people don't understand why or how other people become drug addicted. They may mistakenly think that those who use drugs lack moral principle and willpower, and they could stop their drug use simply by choosing to stop. In reality, no. Drug addiction is a complex disease, and quitting usually takes more than good intentions or a strong will. So drugs changes the brain in ways that it's so hard to quit, even for those who really want to or love to quit it. Nah. So there are numerous drug consequences or effects. So it can affect us physically, mentally, socially, and spiritually. So that's it for drug addiction. I'm gonna slide you to our next speaker. Thank you.
Hello, everyone. I'm Katrina Tarongoy. Good afternoon. And I will be the speaker for the risk factors. Next slide, please. So in here, we will know the risk factors or mga factors why ang tao mo engage or mo gamit og drugs. So ato makita diri no are the many factors that can add to a person's risk for drug use for drug abuse. So we have here the environmental factors. Environmental factors are external influences that can affect an individual's health and well-being. So having a group of drug-abusing colleagues. Peer pressure is one of the leading causes of alcoholism and drug abuse. Many young people are said to have begun using drugs for the first time as a result of social pressure from a group of peers who were regular users. So no, if natin mga barkada bitaw na let's say hilig kayo parties, hilig mag-inom, and ikaw na gusto pud makisabay nila, no, makabuhat pud ka or maka-follow sad ka sa ilang mga doings. Uh, so that is why peer pressure is one of the leading causes of alcoholism and drug abuse. Another environmental factor, attitudes and values of one's family, parental neglect or lack of family care, and the events in one's life that one experiences as a child seem to have a profound impact. So some signs of risk can be seen as early as infancy or early childhood, such as aggressive behavior, lack of self-control, or difficult temperament. As a child gets older, interactions with family at school, and within the community can affect the child's risk for later drug abuse. So usahay no kanang our family situations bitaw can heighten a child's risk for later drug abuse. And then next risk factor is genetics. There's also biological causes no in drug addiction, such as having a family history of drugs or alcohol abuse. So drug abuse development can be influenced by a person's genetics. They are crucial in determining is not whether development is accelerated. Any addiction in the family is a risk factor in this case, and this disorder is commonly caused by some highly addictive drugs. So our gender, our race, and geographic location can also play a role in how and when children begin abusing drugs. So next slide, please. Next, we have the dual diagnosis. Underlying mental health issues can increase your risk of addiction. In turn, an addiction can increase the severity of other mental health conditions, and this creates a vicious cycle in which your addiction tends to progress quickly and with severe consequences. Lastly, we have the early use. So Another risk factor for addiction is the age at which you begin the behavior. An addictive behavior when you're young can also impact your brain development, making you more prone to mental health disorders as you get older and your addiction progresses. So early abuse often includes such substances as tobacco, alcohol, inhalants, marijuana, and prescription drugs such as sleeping pills and anti-anxiety medicines. So that is all for the risk factors, but we also have to take note that there are also protective factors, and one of it is self-control, and which I think is the most important thing to do. So that ends my discussion to risk factors. Let's move forward to the next topic, which will be discussed by another speaker.
So good afternoon, everyone. My name is Miss Yoshada, and I am going to tackle about Philippine setting of drug addiction. So next slide, please. So here I am going to discuss about the drug addiction in the Philippines. So here we are going to know about the percentage of drug users in the Philippines. So in the Philippines, nearly half of drug abuse cases starts from ages 15 to 19 years old. So most drug users develop their substance abuse in their teens. So teens who engage to drugs take drugs from their parents. So let's trace back from the risk factors. One of the one of the causes why teens engage to this activity is because they lack from guidance. So they are a product of bad parenting or lack of family care. Next is about 46% of high school students are exposed to experiment with illegal drugs. So also in the environmental factors, peer pressure is one of the reasons why teens engage to these activities out of their curiosity. So next slide, please. So there are various of factors why drugs is very prevalent in our country. So there are 5 factors. First is geographic factors, economic factors, political factors, social factors, and media exposure. So geographic factors, this includes the patrolling and protecting those planters of marijuana and the smugglers of methamphetamine. So they are protecting the plantation of marijuana, although this has a medical benefits, but some people abuse this. That is why it is still considered as illegal. Next is the economic factors. So this includes poverty. So mainly because of poverty, they lack income or they cannot sustain their needs. One of their gateway is to sell drugs, and then also they also tend to use these drugs. Next is to political factors. So some politicians or people in power are protecting drug lords and drug users because they can earn money from it. So that is why it is still the issue of drugs is still wide because people in power are still protecting them or they are the ones who are behind this. Next is the social factors. So this includes peer relationships, and of course, family background. Next is the media exposure. So social media is a uh, very, very wide source of drug addiction because it portrays the decreasing of moral fabric in the society. So that is why it is very important that we need drug education so that we can eliminate these underlying factors as to why drug addiction is arising in our country. So I am now going to pass the slide to the next speaker. Thank you.
Okay, moving on. Good afternoon, by the way. Before I discuss about the importance of drug education, let me introduce myself first. I am speaker Sigrid Ivy Trinidad. Okay, so we all know that the aim of drug education is to increase the individual's or people's awareness of the risks associated with specific drugs. And this can include short-term risks such as overdose and long-term risks or issues associated with dependence. Next slide, please. Okay, also, effective drug education is important because young people are faced with many influences to use both licit and illicit drugs. Education can play a counterbalancing role in shaping a normative culture of safety, moderation, and informed decision making. And as you can see from the picture beside, the word drug itself describes the question, do I really understand what I'm getting into? So stop and think. Okay, that is all about the importance of drug education. I am now passing this phone to the next speaker. Thank you.
Once again, good afternoon, everyone. So, why we need school drug education? So, we need school drug education so that engaging students in drug education activities assess them to make healthy and safe choices, identify risky situations, and develop strategies to prepare them for challenging situations. Now, what is an effective drug education? So, an effective drug education can increase students' knowledge, social and life skills, and practical skills towards licit and illicit drug use. Next, include content relevant to young people's experiences and interests, and provide significant coverage of relevant issues. And lastly, engage parents in students' development. So I'm gonna pass for for the next slide to the next speaker. So thank you.
Okay, next is how to prevent drug addiction. By the way, I am back with your speaker, Secret Ivy Trinidad. Next slide, please. Okay, so here is the parenting guide to prevent drug addiction in 3 easy steps. Next slide, please. Okay, first is being knowledgeable. You should be well informed on how drugs can greatly affect you and your mental health as well as your physical health and how it can also destroy health work relationships. Okay, so why we should be knowledgeable about it? Mainly because first, to encourage the teen to make positive decisions. Second, to educate the children. And third, to be aware of the decisions the child is making on their own. Next slide, please. Okay, next is communicate. It is really important to communicate knowing that drugs has its threats or risks. So how do we communicate? First, you should pick a good time. Second, take opportunities to talk. Third, let them know your values. Fourth, avoid scare tactics. Fifth, know their friends. And sixth, be realistic. Also, in communicating, you should say what you mean to say and always stay calm so that you won't raise your voice when speaking. Also, don't just talk, you should also listen. Next slide, please. Okay, last is have a safe home. You need to keep your house safe and ensure that your children are safe in your home. Also, don't share drugs with others. Keep your home safe and ensure that your children are safe in your home. Next slide, please. Okay, so those are the important things you need for your health. Okay, so those are the steps in preventing drug addiction. Once again, the 3 easy steps are be knowledgeable, communicate, and have a safe home. Thank you so much for listening.
So Mhm. so we prepare a short video to end this discussion. So let's watch together.
Understanding substance use and abuse. Misuse of substances like alcohol and drugs is a growing problem in the U.S., and teens and young adults are most at risk, with half of all new drug users being under the age of 18, and 1 in 5 high school students having abused prescription drugs. Additionally, 1/3 of high school students currently use alcohol, 23% use marijuana, and 22% use all forms of tobacco combined. Decision-making in teens involves a chemical called dopamine in the brain's reward center. Dopamine helps transmit signals in the brain that make people feel happy. The number of brain receptors interacting with dopamine is higher in adolescence than at any other time of life. That means that when a teen is exposed to a reward, such as a compliment, the reward center reacts more strongly than it would for an adult. Also, being with friends increases the sensitivity to rewards and makes the already sensitive reward system even more sensitive. Feeling rewards more strongly and responding more intensely to what peers may think means that there are biological reasons for why teens sometimes decide to do things with their friends that they would never do on their own. This can be positive by encouraging friends to take on new challenges, but it can also lead to dangerous decisions, such as drug and alcohol use. Drug use and abuse can contribute to harmful short and long-term health risks. In fact, drug abuse can have long-term effects on a developing teenage brain. MRI scans of the brain have shown that people who have been using drugs for a long time have a smaller prefrontal cortex than people who have not been using drugs. The prefrontal cortex is the area where decision-making occurs. Drug use can result in poor grades, memory loss, and social problems. A lot of us have an idea about what a person dependent on drugs looks like. However, anyone can suffer from this type of addiction. Addiction doesn't depend on income, job, age, race, or color. It is a disease of the brain that can happen to anyone. Drug dependency is when a person consumes alcohol or drugs regularly, despite the fact that it causes issues in their life and relationships with others. Get help if you need it. Encourage your friends to get help too.
So these are the references. We would like to acknowledge these websites that make this webinar drug education possible.
So, a friendly reminder before we end this webinar is prevention is always better than cure. And of course, always say no to illegal drugs. So I hope you learned something from our very short webinar.
Okay, before we end our webinar, may I ask all of the people here in the Google Meet to please turn on their cameras for documentation. This will only be quick.
Okay, wait lang. Ako say adjust so that I can show everyone. Oh, wait. Ang saan na siya ng full tanan? Dili niya makita. Ako ano lang ibay, ansa ni, by tile pag kuan.
Sige, sige.
Nile! Sige, wait sa ha. Ako na lang i-picture kay dili siya makuan.
I would like to encourage everyone to open their cam for just documentation purposes only.
Wait lang ha. Ang saan na pag-slide?
So, ready na ba tanan? Lang tayo mag-count,
Hello,
1, 2, 3. Di ba? Ano ba tayo mag-count?
Alam, hindi na makita tanan. Gamay na lagi makita. Wala ka itong mag-tile.
Miss Jans.
Oh my God, wait lang guys. Sorry kaan. Sorry na ana di ay.
Yeah. Pag-count of 1, 2, 3 ano? Para ma-prepare itong picture.
Sige, sige.
Na 16
Yung
na
siya
yung
mag-count.
makita. 16 na din ang tao. Sige, ako na lamang. Sige, 1, 2,